Southwest Medical today is because this is the epicenter of a measles outbreak. We've been the focus of local, national, even international news reports. A team from the BBC was here last week to find out what's going on in Clark County, Washington. And to answer those questions and any questions that you may have, we have Dr. Jason Hanley with us. You are the medical director here at Peace Health Southwest Medical Center, and we're in your emergency department right now. Fortunately, you haven't been called away to take care of anyone.
No.
Tell us about how this measles outbreak in Clark County has affected your team and what you've been doing over the last month.
Yeah, it's been a pretty big impact administratively, as well as the nurses and doctors on the ground. We moved pretty quickly with our infection prevention team to prepare the emergency department as well as our outpatient clinics to make sure we can keep our community safe, to not only care for the people that could possibly have measles, but also everyone else that could possibly be exposed to them.
Now, measles was thought to be eradicated. Back when I was born, a long time ago, late 1950s, early 1960s, there were about 3 to 4 million infections a year in the United States.
Absolutely.
That's down into the hundreds now. Things have changed significantly, but now we're going back in the other direction. What's going on?
Yeah, we hit our nadir probably in 2004, and now when we have a couple hundred cases a year, it's pretty serious. And as you've seen, it's a concern that brings a whole community together. So what we believe is going on is the fact that in the early 2000s there was a push against vaccines, as well as there's more and more international travel among our fellow citizens. The use of vaccines is not as prominent in other countries, especially Eastern Europe, among other continents. So anytime we travel to those areas, or those folks tend to come to our areas, we have a certain segment of our population that's susceptible to acquiring measles, either because they're not vaccinated or they can't get a vaccine, or they're immunocompromised and puts them at risk.
How serious is getting the measles? A lot of the people who have commented on this in advance of today's presentation have said, oh, I had measles when I was a kid, it was no big deal.
Sure.
It is a no big deal for some. That's not the case for everybody, is that correct?
Yeah, it's a pretty uncomfortable virus. But yeah, as you mentioned, back in the 1950s and before, millions of people would get this a year, and they would be immune from it the rest of their lives, and most of them would get through it. But 1 or 2 people out of 1,000 eventually die from measles, so it's a very serious disease. Most concerning to us are the vulnerable population, so children under 5, immunocompromised people, whether it be cancer or another medical problem, or pregnant women, are more susceptible to the virus and can get even sicker. So those ones we really worry about.
If you've just joined us, we're talking with Dr. Jason Hanley. He's the medical director at Peace Health of the emergency department at Peace Health Southwest Medical Center in Vancouver, where we've seen an increase in measles cases. We're over 50 right now. All right, so we talked about measles can be dangerous for some people. What about the vaccine? There's a lot of talk that getting the vaccine itself can put you in danger. What are your thoughts on that?
Sure. Overall, the vaccine is very safe and very effective. If you get 2 vaccines, literature will tell you 97% assured of not getting measles. There's still 3% chance, but probably even lower if you get 2 vaccines. In terms of having a reaction to the vaccine, maybe there's literature out there saying 1 in a million people will get a serious reaction to it. So again, very, very safe. There was a lot of concerns in the early 2000s that there's a link between the vaccine and autism, and that has pretty much been debunked by literature. And the investigation team that came out with that, the physician out of England, has actually came out and said he made up a lot of those facts. So that information alone caused a lot of people over the last 18, 20 years to not vaccinate their children because they wanted the best for the children. But as we know now, it's probably much, much, much safer to get a vaccine than to not.
Yeah, I want to back up just to repeat that for anybody who may have missed it. 1 in 1,000 cases, is it 1 in 1 million? 1 in 1 million has a severe reaction. Now there are milder reactions that you can get to the vaccine. Those don't count as severe. What would some of those be?
Body aches, chills, fevers, localized rash or irritation where the shot is given are very common, not only with MMR, the vaccine for measles, but a lot of our other vaccines as well.
Now, it strikes me in reading through the literature that a lot of this is similar to flu in a way that if you're a healthy person, you get the flu, your chances of coming through it are better than if you're a member of a certain population. In some ways, that seems like what we're seeing with measles as well. And so if, for example, you're young and healthy and handsome as you are, you might be a guy who could say, I don't need the vaccination because I'll be just fine.
Sure.
But that could be a little bit selfish motivation on your part because there are a lot of people out there who don't get to make that choice, if you see what I'm saying.
Yes, it's a great point you bring up, and what you're saying is something we refer to as community immunity or herd immunity. So you're making a choice for yourself, but more importantly, you're making a choice for the community. If we get enough people vaccinated in a certain population, the chance of that disease spreading rapidly is much, much less likely. That chain of infection needs to go from one person to another person to another person. So if we can get vaccination rates up, depending on the disease, 90-95%, you can almost eradicate it, like we almost saw with measles, like we have seen with polio or smallpox. What we don't want to do is there's certain people that can't get the vaccine. They are allergic to the vaccine, or they have a medical condition they can't get the vaccine, or the body doesn't respond to it. Most importantly, the biggest population we see are any of our children under age 1 do not get the vaccine. Usually we give patients a vaccine at 12 to 15 months. So we want to protect those children with herd immunity. If enough of us are vaccinated against the disease, we won't see it pop up in the community like we have here recently.
I know of people, this has changed their lives. We have friends who have little babies, 3 months old. When they come home from work now, they stop at the front door, take all their clothes out at the front door, leave them at the front door because they don't know if they'll have the measles virus on their clothes, and they don't want to bring that virus into the home where they have this unvaccinated baby.
Sure.
They can't take their babies out to go shopping. I mean, they're in essence prisoners now in a way that they didn't think was possible before this outbreak.
Correct.
And that's a choice that is being made not by them, but for them, by other people.
Yes.
I'm talking with Dr. Jason Hanley. He's the medical director for emergency services here at Peace Health Southwest Medical Center in Vancouver, Washington. We have some questions that have come in on Facebook. Would you mind if I ask you some of these questions? Jennifer wants to know, can you get measles if you have been vaccinated?
You can, Jennifer. It's rare, and that means the vaccine didn't work. This vaccine in particular, is, after 2 doses, is 97% effective. So it's not perfect, but it's very close.
Yeah, so you can get it, but 97% protected, and also the chances of you spreading it to someone else are less if you've been vaccinated. If
Absolutely. You have to acquire the disease to become infected, yes. And if you do get the disease after you've been vaccinated, you tend to get a lesser virulent type, so it's not quite as severe, and you're not as contagious as well.
We have another question. This comes in from Melly. She wants to know, has anyone died from this current outbreak? Now, here in Clark County, I think our total is 53 confirmed cases with a few more suspected. That qualifies as an outbreak by 21st century standards, not by 20th century standards, but what so far has been the result that we've seen in our community? Any deaths?
No deaths, no.
That's good news.
Yes.
Another question, have doctors decided to try to vaccinate babies? Would that be up to you, and if so, would that be a safe thing to do?
In terms of, if the question is, have we decided to vaccinate babies under 12 months, we have certain protocols. If a baby's exposed within 72 hours, we can give the vaccination. Usually we wait until 6 months to do that. We work with Clark County Public Health to make that decision. We can also give another type of medicine to protect them. And that's something we've done quite often here in the last month.
Let's talk a little bit more about that. It's not the vaccination that you give at that point. It's a completely different medication for people who have been exposed.
Yes, immunoglobulin.
immunoglobulin.
Yeah.
And
We tend to save that for at-risk people, mostly young children, immunocompromised patients, or pregnant patients.
Okay, and so that's something that you do in the extreme circumstances. I've read and heard a little bit about that process, and it sounds like it's not a fun process. It's not just the typical shot, is it?
Yeah, it's a choice between ourselves and the patient and the health department. How risky was their exposure, and whether they get a shot or an IV infusion of the medicine.
Okay, Dr. Jason Hanley, Medical Director at Peace Health Southwest Medical Center in Vancouver, Washington. Another question comes in, what if my child has had only one shot because he's not old enough to get the second shot? So the MMR vaccine is supposed to be a 2-shot process.
Yes.
Okay. And it says because he's not old enough to get the second. I would think that if you're old enough to get the first, you'd be old enough to get the second.
Yeah, we tend to space those out somewhat.
Okay.
And again, we have a system where we can look through and see how risky the exposure and how risky the patient is. We may give it before the 4 years. We tend to give it at age 1 and age 5, roughly. But again, some patients, if the exposure is significant and we see them within 72 hours, we may give a second dose earlier versus do we, if it's beyond 72 hours, or if we think, you know what, let's give the immunoglobulin, we'll give that.
Mm-hmm. Another question comes in from Facebook. What would we do if we're not sure if we were vaccinated? I called my mom. She couldn't remember.
Sure.
She said, I can't remember if you had chicken pox or measles, or if that was your brother or your other brother or your other brother. So she wasn't sure. What does somebody do if they can't rely on their mom's memory?
Well, I would try to go back to your previous physicians or your current doctor now. A lot of times they have that on record.
Mm-hmm.
Discuss the risks and benefits with them, and decide if they're unsure. They can either check a titer, which is taking a blood sample and seeing if you truly are immune to measles, or get another vaccine.
Mm-hmm. There is an online resource too. It's MyIR, and I think it's myir.com, but it might be .net or it might be .org. My memory's faulty, not just my mom's, but it's MYIR, and they have a database for the state of Washington where you can access your records, and it might be able to get the answers from that.
That's great.
And again, if you just joined us here on Facebook, we're talking with Dr. Jason Hanley. He's the Medical Director for Emergency Services at Peace Health Southwest Medical Center in Vancouver, Washington, where we unfortunately have been at the epicenter of an outbreak of a disease that was considered to be eradicated about a generation ago. Have you personally seen or treated a person with measles? Have you seen the rash?
I saw one case in my training back in the early 2000s, and I've seen a few cases here by my partners who were treating them, and I was assisting with our protocols and whatnot. It's
interesting to think that this outbreak is so recent that there are some doctors that are newer that they haven't even seen this disease yet.
Absolutely. Our first case here, again about a month ago, one of our physicians grabbed as many nurses, nursing students, techs, other physicians, say, come look at this rash. This is a classic measles rash because it's so rare to see anymore.
Mm-hmm. What are the main questions people have for you? When they find out you're a doctor, do they say, doctor, I got a question for you? Misinformation, primarily. Things people think they know because they read it on the internet that may or may not be true. What kind of correcting have you been doing for people over the last month?
In terms of the measles, a lot of the correcting is any rash and any cold symptoms, it's presumed to be measles because it's been talked about so much the last month, which is a great question, a great thing to present for. So we're really encouraging folks to contact their doctor, their nurses, or come in and ask. The last thing we want to do is someone not to ask those questions and be out in the community.
If people do come in, you want them to come in a precise way. Now, you have an emergency department, which is different from an urgent care clinic, which is different from a primary care provider. You don't want people to just park their car, run through the parking lot, and announce themselves at the front desk. Hello,
Correct.
I think I have measles.
Yeah.
That's not what you want.
No.
What do you want people to do?
Ideally, what we'd love to do is get a phone call from either yourself or your physician so we can prepare. And we'll actually bring one of my doctors out and assess you or your child in the car to make sure that we're safe. if there's any risk at all of it being measles, we'll put a mask on the patient and bring them through a back door into a room that's safe, and keep it away from all the other patients in the waiting room or throughout the department.
And that's not just for your emergency department, that's anybody who's considering going to see a doctor anywhere.
I would call first, yes.
Yeah, call your doctor ahead of time.
How best to keep everyone safe.
Can measles affect an unborn baby? This is a question from Facebook. An unborn baby, if mom is pregnant, there's a risk to mom? Is there a risk to the baby?
That's a really good question. If mom is covered with a vaccine, that should be fine. If mom is unvaccinated, there certainly is a risk to the fetus, yes.
Okay.
And I don't know enough about that to share exact details, but
okay.
It's certainly concerning, yes. And
Yeah.
that's why we do our best to protect the pregnant members of our community.
Absolutely. Another question. A lady says, I'm 38. Should I get vaccinated again? Assuming she's saying she's been vaccinated before.
No.
Okay. It's a lifetime thing. When you have your vaccination, whether you got it when you were 12 or 22 or 42.
If you've had your 2 MMRs, you should be fine.
Okay. We got a question. I have a 2-month-old. Can he get vaccinated? 2-month-old baby. Can he get vaccinated?
Unfortunately not.
So this is an example of a person who's at risk then. It's 2-month-old and their parents can't make the choice for the 2-month-old. It's all the rest of us have to step up and make that choice.
Yes.
Okay. CJ writes in, do babies under the age the vaccine is typically given have antibodies against the disease via breast milk? If so, for how long? Now, I know you don't work in our family birth center with our lactation experts, but can the vaccine be passed through breast milk?
It wouldn't be the vaccine passed through the breast milk. I think we want to talk about the mother's protection.
Mm-hmm.
And a lot of babies get protection from the mother for the first 6 months of their lives.
Mm-hmm.
So, like you said, this isn't my field of expertise, but I bet a lot of our infants are somewhat protected the first 6 months of life,
mm-hmm.
and more vulnerable from months 6 to 12.
Caitlin wants to know, should I opt to stay home with my 6-month-old baby rather than travel? I would, that's an interesting question.
It's a
I'd
great
say
question.
if you're traveling to Eastern Europe, then that would be a different answer than if you're traveling next door to have coffee with the neighbor.
It's a great question, and being on an airplane with recycled air is extremely concerning for anyone with a young infant or another family member who's vulnerable. So it's a difficult question to answer. Everybody's got to weigh those risks with themselves, depending how important the travel is.
We're talking with Jason Hanley. He is the medical director for emergency services at Peace Health Southwest Medical Center in Vancouver, Washington. And Sarah has a particular question for you specifically. She'd like to know if you're vaccinated. You don't have to answer, but
Sure. I am. My mother vaccinated me, and I thank her every day.
yeah, I'm vaccinated too. In fact, my mom was a school nurse at the time, and she was there when it happened. She witnessed my vaccination, so I had to be strong to not embarrass her.
And people in general in healthcare and education, other military, it's so important to be vaccinated, not to spread it to the vulnerable population. So it's almost an ethical and moral obligation of ours to cover ourselves. Unless we have a very strong personal or religious belief against vaccination, it's strongly encouraged, not only here at Peace Health, but all medical personnel.
Jen wants to know, how safe is it to travel to Portland or Washington for sporting events if we have had one or both shots? You know, there was an exposure at the Moda Center during the Portland Trailblazers game. So this is the answer to this has got to be, you know, how risk averse do you want to be? The safest thing is to sit in your house and go nowhere. But then you could possibly choke to death on a hot dog. So,
Correct.
you know, everything is a question of risk. Sarah wants to know, are people contagious shedding after they have been vaccinated? So you get the vaccination, your body is now trying to establish immunity. Are you shedding now? I mean, that's a term that she uses, not mine. I don't know if that's a real term or not.
Correct. No, you are not contagious to anyone else with the vaccine.
Okay, and for people who don't know how the vaccine works, it's a live virus, but it's a weakened virus that goes into your body, and then your body starts fighting it and develops an immunity to that. And that's why when you're in that window of time, anywhere from a week to 3 weeks out, you might feel some symptoms of that. That's your body building an immunity to that.
Correct.
I'm talking like I'm a doctor. Maybe I should put on the white lab coat.
I should give you my coat.
Talking with Dr. Jason Hanley from Peace Health Southwest Medical Center in Vancouver. He's the Director of Emergency Services here at Peace Health. We're so grateful to you for taking the time to talk with us, because I know that you have a lot of things to be doing during the day, and we're really pleased that you could be here. Now again, a reminder for what people should do now to protect themselves, protect their family, protect their community. To protect themselves, what should they do?
To protect themselves, if you're one of those people that have chosen not to get a vaccine, or maybe a lot of folks out there have just been so busy and haven't gotten around to it, please do the research. I hope it changes your mind and get a vaccine. That's most importantly. Secondly, if you're sick or know others that are sick, make sure that they cover their mouth, wash their hands. Typical virus education that we give all people. And be on the lookout for people that are vulnerable. Like
you mentioned this is a highly contagious disease. This is not one of those things where you just wash your hands and you're protected. Much more contagious than that. How quickly can this spread?
It can spread extremely quickly. It's one of these diseases that, on the spectrum of diseases, it's very, very contagious. So if you walked into a room and no one was vaccinated or no one had been exposed to that disease before, 9 out of 10 people would get measles.
Wow.
And if the person walked through the room and coughed or sneezed, the droplets that they form can propagate measles for the next 2 hours within the room. So you can imagine if somebody sneezed on their hand, touched the doorknob at the airport, how many folks get exposed over the next 2 hours.
So if my numbers are correct, I'm in the room, you're in the room, and we got Michelle and a couple people over here. If all of us were unvaccinated and a person with measles walked through here, the chances are good that all 5 of us would get measles.
Yeah,
and 4 other people who might be
90% chance individually, or 9 out of 10 of us would. It's impressive.
That's what they mean by highly contagious.
Yes.
Ashley would like to know, is it safe to go grocery shopping and running errands with a 2-month-old? What precautions can be taken when needing to go outside in public? And if you have a 2-month-old, you have to get out. You have to do things.
Sure.
You have to live your life.
You have to live your life. The one thing you could do is put a mask on a vulnerable person to protect them. Not foolproof, but wash hands constantly.
All right. And Sarah asked a similar question. My daughter is 6 months old. Should I avoid leaving the house?
Yeah.
It's a tough one. You can tell there's a lot of concern out there. People want to do what they can to protect themselves, protect their family, and protect the community. So if people were focusing on protecting the community, maybe we wouldn't have questions from Sarah like, why can't I even leave my house?
Right.
As if we would get back to that herd immunity that you spoke of a few moments ago. We have to be asking you these questions today.
Absolutely.
All right. Jason Hanley, we appreciate you taking the time. Again, if you have more questions for Dr. Hanley, type them into the box on Facebook. We'll present them to him, and we'll get those answers to you after the end of our live broadcast. And I'm going to shake your hand, and then I'm going to go use proper hand hygiene. We're reporting here from Peace Health Southwest Medical Center in Vancouver, Washington, where we had more than 50 cases of measles over the past month, and we're hoping that we've peaked and we're going downward, and we can only do it with your help. Thanks for joining us, everyone.